Welcome to Public Health Impact. I'm Phaedra Corso.
And I'm Cham Dallas.
This is the second in a series of shows from the University of Georgia's College of Public Health, where we explore exciting public health issues and their impact on our communities.
In this second episode of Public Health Impact, we're going to cover the field of disaster management and emergency preparedness.
Well, that's ironic, Cham, because that happens to be your area of expertise.
Yes, I've been in this field for a long time, 20, 30 years now.
Well, before we start, you've got to tell me, where are we today and what are these gruesome pictures behind us?
Well, we're in the Emergency Operations Center of the Institute for Health Management and Mass Destruction Defense at the University of Georgia. And these gruesome simulations back here are, well, they are gruesome. They're nuclear attack simulations for mass casualties in Washington, D.C. I did them for Senator Joseph Lieberman. He's a chair of the U.S. Senate Homeland Security Committee, and I presented them these actual posters back about a year ago for what would happen if or when we have a nuclear attack and mass casualties in our nation's capital.
So, Cham, my first question for you is, we're talking about disasters today. Can you give me some sense of the scope of the events that we're referring to?
Well, really, mass casualty events can be really big or they can be really small. The key factor in all of them, regardless of size, is need exceeds resources. That's all there is, whether it's a hurricane or a bus, turning over with the casualties coming to an emergency room. Need exceeds resources. We're outside the realm of the normal.
So give me some examples of disasters that we've been witness to in the last year or so.
Well, of course, the one most people think about with natural disasters would be Haiti, the big earthquake. Tens of thousands of people dying and hundreds of thousands affected. There was some good management there in small groups. There was also some very bad management as well because of the scale.
Mm-hmm. In the U.S., have we seen other big-scale disasters like this?
We have, and most people think in the United States about Hurricane Katrina. I think there's a consensus now that there was considerably bad management there with that one. For instance, we had 12 hospitals that shut down, 9 of them because of security, not because of rising water. There were some real problems there. And in Hurricane Katrina, New Orleans still hasn't recovered. The city was abandoned, only partially recovered. Now a horrendous murder rate, and years later, still recovery hasn't occurred.
And of course, no one can forget 9/11, which we're coming up on 9 years now. And so, what was the scope of that event?
Well, 9/11 really changed everything. It changed the country. We call it a new normal now. We're never really going back. It changed the field of disaster management. A lot of money came in, a lot of new people. Almost every city, every county perhaps in the country has new equipment, new training. It's really changed everything.
Did your institute, IMAD, was it funded through 9/11 funds?
We were here long before 9/11. I was at Chernobyl, where the Russians managed to blow up a nuclear reactor in the former Soviet Union. That's why we're the experts in this field now in nuclear war. But, on September the 10th,
the day before,
Senator Cleland, who was senator at the time here in Georgia, was giving a speech on the Senate floor about IMAD and the work that we were doing. Of course, the next day, nobody was at work, because that's when they crashed those planes into the towers.
So you and I are friends and colleagues, and I know that your training is in toxicology. If someone else wants to be in the field of disaster management, what kind of training might they need?
Well, of course, MDs, nurses, PhDs, all these people can get disaster management training. Typically, what we recommend is that people get an MPH, a Master's in Public Health in Disaster Management in your department, Health Policy and Management. And of course, that can also be a disaster management certificate, which many different professions can get, even when you're not in school.
That's wonderful. So who are we going to be talking to today?
Well, we're going to talk to the scientists and public health professionals here in IMAD. We're going to talk about the Food Emergency Response Plan that we wrote for the state of Georgia. Mm-hmm. In fact, we had a big exercise where you can show how easy it is to adulterate the food supply.
What do you mean adulterate? What does that mean?
Adulterate, that means when you're going in and putting something bad into the food.
Oh.
Yeah, and that unfortunately is a real hazard for us. We're also going to cover the hospital exercises that we do for all 150 hospitals in the state of Georgia, getting the hospitals ready for mass casualties. We'll talk about nuclear war and the disaster management for that, which we're expert in. And then finally, we'll talk about the special needs populations, the nursing homes, and how to protect those vulnerable populations in disasters.
I know that was a big issue in Katrina, so.
It was. There were a lot of people who died there.
Well, it sounds like we're going to have a great show, so come on back after the break.
Okay.
I'm now being joined by Dr. William Bell, who's a senior research scientist here in the Institute and also in my department, Health Policy and Management. Bill, there's not a week that goes by that we don't hear about terrorists and about the potential of a nuclear event occurring in the United States. How has the Institute been involved in that dialogue?
We've been working about 5 years in the field, and we've presented our results to the House and Senate Committees on Homeland Security, and we've written a number of papers showing the impact of nuclear weapons in the health field, the health system field, and how you would prioritize responding to casualties. It'd probably be 100,000 casualties you need to respond to.
I think that most people would ask you, being the expert in this area, how worried should I be? What is the probability of a nuclear event occurring in the United States, and when might it occur?
Well, it's a low probability event, but it has huge impact. So obviously you don't want it to happen, and if it does, you want to be able to respond. 5 to 10 years is the time frame that most of us think that it's a real issue.
And how will I know an event is occurring?
You'd see a flash in the sky, and you better react quickly, because right behind that flash, 1-2 seconds, you're going to get a blast wave, and you need to be protected from that as best you can. And once the blast wave is gone, you need to go inside, in preferably the center of a building, a basement or middle floors of an apartment, and stay there at least 24 hours, or until someone tells you you can leave.
So what you're telling me, it sounds like it's not going to be the end of the world if there is a nuclear event.
Far from it. You just have to look at Nagasaki and Hiroshima that experienced probably larger events than a terrorist event would be. And they're thriving, bustling cities today. So far from the end of the world.
Okay, well, thanks for giving us that optimism. We'll be right back. To get a preview of the next topic we're going to cover, let's watch this IMAD video of a food disaster.
We are following the breaking story after this morning's shootout in Jefferson. Brian Benson is live on the scene, reporting with some new information. Brian, tell us the update.
Thanks, Peter. The hazmat team has been out with some evidence that they wouldn't show to us, but we were able to zoom in and catch this image on freeze frame. Two apparently were meat packers at Oscar G's, which is the chicken plant on River Road. The hazmat worker also carried out an unlabeled gallon bottle of a liquid marked as evidence. We see some very large syringes with brown liquid in them in an evidence bag. They're carrying boxes of breaded chicken tenders from Oscar G's. Both are marked with evidence stickers. It seems logical to suspect foul play with the chemicals we've seen, the huge syringes, and all that breaded chicken. It makes you wonder if our food has been tampered with.
Wow, that was dramatic.
It was. We had a lot of fun filming that last summer.
We're joined now by Dr. Robert Wentworth, who's a toxicologist in the Institute, IMAD. Bob, you got to tell me, how serious an event is food contamination?
The United States has a remarkably safe food supply. On the other hand, CDC does estimate that about 76 million Americans get sick from foodborne illness every year.
Wow, that's a lot of people.
It is, although most of them recover on their own. There are about 5,000 foodborne illness deaths in this country every year.
And so what is the Institute doing to deal with food contamination?
Our institute has partnered with the University of Georgia Department of Food Science and Technology to develop a food emergency response plan for the state of Georgia.
And what is the plan all about?
The plan was originally started through a cooperative agreement with the United States Department of Agriculture. We involved the Georgia Emergency Management Agency and the Georgia Department of Community Health, and we had two goals as we started putting that plan together.
And what were the goals?
The goals were to develop a plan for food emergency response in the state of Georgia, and then to test that plan through a series of exercises.
Oh, I bet the exercises were very interesting.
They really were. The first was a tabletop exercise, which was just a get-together of food industry representatives, state agencies, and federal agencies for a one-day discussion type of format to develop the command structure that would be used in a food emergency response in Georgia. The second was a full-scale exercise that took place at locations all across the state of Georgia.
Oh, well, tell me about the second exercise, because I think going out in the field is probably where you get most of your important information, right?
Yes, it is. It gave us a chance to really see what state agencies could do and how they would interact with industry. The video that we saw a few minutes ago was part of that exercise. In that exercise, we used real food and a real food distribution facility, a retired facility that's no longer in use, to model a widespread food contamination event.
And I imagine that from the exercise you learned some lessons?
We learned a couple of really important things. The first was that if nothing were done to prevent it, a large-scale food contamination event could cause thousands, tens of thousands of people to get sick in Georgia. The second was that with some quick, effective action by those state and federal agencies, the number of people sick could be greatly reduced.
Well, thank goodness that a plan exists, right?
Yes.
And so what are your next steps?
The next step is to continue working with the Georgia Emergency Management Agency and the Georgia Division of Community Health to get the plan adopted into the official state emergency operations plan.
Please, Bob, do it as fast as you can.
We're working on it.
Okay, so if someone wants to know more about food contamination events, where would they go?
I would recommend that they go to the United States Department of Agriculture Food Safety Inspection Service website at the website location on the screen.
Okay, well that's great. Thank you so much for this information. And so, do you have time for lunch?
Let's go.
All right, but no contaminated food.
No contaminated food today.
Great, thank you.